Welcome to Get Moving TV. I'm Dr. Chris Landon and I serve as your host. Well, it's been a very long year. We haven't been in the studio, and a lot of things continue to happen though. We have made tremendous extensions of health, extensions of lifespan across the globe, doubling lifespan. But what we're finding is we're hitting this block, and that is the social determinants of health. We've undertaken a program here in Ventura County called the Adverse Childhood Experiences, ACEs, and that's continued to go on over this year. With me today is Emani Kelley. Emani, welcome to the show.
Thank you. Thanks for having me.
So I have followed Emani since she was a glint in her father's eye, I think, probably. Mm-hmm. I trained her father, who's a director of obstetrics, as a first-year resident at Ventura County Medical Center, and her mother is a school nurse. And Emani, despite growing up in a medical household and trying to run away from it, keeps drawing you back. So tell us a little bit about your education and how you got back to Ventura.
Mm-hmm. Yep, so my schooling all within Ventura County, and I guess I just wanted a change of scenery, a change of pace, so I ended up going to the Midwest for my undergrad, to a tiny school that no one's ever heard of, the College of Worcester. And that's where I spent my 4 years studying psychology and Spanish and Latin American studies.
And you spent a summer with us.
I did, yes. I was a student fellow, partnered with my university, and did some research with you, Dr. Landon.
What did we look at?
We looked at technology and how that can fit into the school systems in terms of bettering students' health and outcomes.
Yeah, giving information about nutrition, because that's a big piece. It's the self-induced health problems.
And we made it bilingual as well,
yes.
So trying to get that Spanish-English education out there, which is
and
really cool.
Protecting the children from predators too, so that as we did this online education, that they couldn't know where they lived or how old they are, or take their picture or whatever. Right. And then we sent you away. Where did you go?
So I ended up going, after I graduated in 2019, I was a Fulbright scholar. So I went to Spain for what would have been a year as an English teaching assistant. So I was in Madrid, in the heart of the city, living my best life before COVID hit. But I was teaching English at a university with other university students, and I was teaching staff classes in English to other people who worked at the college itself. So I was, kind of getting a taste of teaching, as well as maybe honing in on a little bit of what I want to do later in life. So.
And then we got you came back, and we put you right to work. So tell us about ACEs. I've been writing the grant with Sharon's input, who we'll see later on, and Lucy and everyone else who's really helped with putting the program together. But tell us about ACEs and what kind of questions are asked on this adverse childhood experiences, and who we're trying to teach how to ask those questions, and the resources that we're developing, and everyone else will fill in as they follow.
Yes. So ACEs is Adverse Childhood Experiences, and really what the state of California is doing is spearheaded this project called the ACEs Aware Initiative, partnered with the Department of Healthcare Services and the Office of the Surgeon General, to really make people aware of what adverse experiences are and how they might impact you in the future, in terms of your health, physical, emotional, mental. So what they're doing is trying to get this questionnaire, which is a questionnaire of 10 questions, 10 categories, out to doctors to be able to ask their patients whether they have experienced any type of challenge in their life during childhood. So those questions that get asked cover a broad range of topics. There's 10 categories under the umbrellas of abuse, neglect, and household challenges. So this whole questionnaire really covers everything that could potentially be a challenge for a child that maybe translates later to difficulties in adulthood having to do with their health.
I think Dr. Brooke Harris has been involved in the research behind this and really trying to put something behind it. And what kind of health problems unexpectedly are increased just by having adverse childhood experiences?
So you might not think about it, but things like asthma are increased, cardiovascular disease, which has been widely researched, that has been an effect of ACEs. We've got things like COPD or ADHD, anxiety, depression. So there are a lot of adverse health effects that you might see in a clinical setting and not directly associate being linked to an adverse childhood experience, but they actually are all linked, and that's what we're trying to do as a program, is connect these and normalize the conversation about how adverse experiences in your childhood might have an impact, and what are things that we can do to help mitigate the risk for those things.
Yeah, I think when people go into their doctor, if you're an adolescent, you go in there for acne or a broken bone, that's about it. And so the ability to make that impact, even in the first year of life, every year they're allowed to ask these ACEs questions. Mm-hmm. And by being attached to the Department of Health Services, doctors are paid to do it. But our doctors were initially reluctant. Why were they reluctant to ask these questions? Yeah,
so a big hesitation and question is, okay, what if I ask these questions and have no idea what to do with them? I'm essentially opening up Pandora's box, and there may be this plethora of things that my patient comes in with, and I don't know the resources. So that has been a conversation that we've started with community partners as well, is, what can we do when we start to ask these questions in terms of getting our patients connected to the right type of resource that they need, as well as, trying to just, again, normalize it so that it's, ACEs are very common, and we want to make sure that people know that and don't feel like they're being pressured to answer anything that they don't want to, or, made to feel that they're not normal in some sort of way. So really normalizing that and saying that there are resources available locally. There are a lot of organizations out there doing good work. So.
And we'll hear more about those. Mm-hmm. For myself, my mother was in prison. Parents were divorced. There's alcohol problems. I shouldn't be a doctor, but I had that opportunity of having a family that provided me with learning about resiliency. Mm-hmm. And oftentimes that's where grandparents end up being the major force as well. In terms of resiliency, do you have any information that you give out? Or how do we have websites and I don't know, all the TikToks and all the things that go on with, what do we got?
There's a lot out there. So as an organization, ACEs Aware Ventura County, we've worked hard to make sure that there is information out there in an easy to understand format, easy to access format. So there are patient handouts that really go over, what ACEs are in a very easy to understand way, as well as really covering, this is what resilience looks like, and we are all resilient. We all have the capability to be resilient, and emphasizing, your past does not define your future. So there are a lot of things that we can do to promote those things, like safe, stable, nurturing environments that, promote resilience and help people overcome these adversities.
I think also by opening up the conversation. Now, you're not going to solve everything in that first visit, but it helps people to start to understand, yes, that's what my health is about. It's not just about more amoxicillin or whatever, blood pressure medication, or 5 blood pressure, and then another set of medications for the side effects of that. It's really our health has to do so much about how we interact socially and what resources we have. And there's so many resources in Ventura County. Where is your office now?
Right now, we're located actually at the Ventura County Family Justice Center. So we've partnered up with them in terms of sharing space and sharing resources. So the Family Justice Center is doing a lot of great work within the county to primarily help assisting victims who've experienced some sort of trauma in their past or currently. And getting them the resources that they need. So we've tied in ACEs with that and are trying to work with them to, bring in referrals that may come through adverse childhood experiences.
Now, as a practitioner, I want to know, gosh, is it every single patient? What's been the experience so far? How many hundreds of exams or scores have come out so far?
So far within the system that we're working with, we've had a little over 1,000 screenings completed, and the trends that we're seeing are primarily the scores are lower risk, so within that 0 to 3 adverse experience range. We're not seeing too many high risk scores being reported. That doesn't mean that they aren't out there and don't exist, but it is a little less daunting when you think about that in terms of, okay, I am seeing patients and I can't, do something for everyone in the 5 minutes that I see them. So knowing the numbers of, how many might potentially be that higher risk that should require some sort of intervention is a little helpful when considering, the balance that there is.
And in starting the conversation, people's lives change. So with the children, every year they're eligible for the ACEs screening, and divorce is whatever 50% probably in Ventura County, and alcohol and amphetamines and all the other things that can be a problem. We've done all kinds of interventions. We were talking earlier about obesity, but also for asthma and for perinatal substance abuse. And your father, Dr. Fred Kelley, certainly led the charge with early intervention there. Okay, so how would you, is there anything else you'd like to add in? Any materials that people can go to? We'll run the website underneath so that people can know where to go.
Yes, absolutely. That would be my number one source. Definitely you can visit ACESAwareVenturaCounty.org for more just general information really about what ACEs are and what we're doing in the community and who we've partnered up with. We've also got really good resources coming from the state in terms of what people can do in their day-to-day lives to help mitigate the risk for toxic stress, which we'll talk about a little bit more later. But there's this really great wheel called the Stress Busters wheel that the Surgeon General has created with evidence-based strategies to use in your day-to-day life, like going outside and experiencing nature as a stress buster, or access to mental health care, or getting a good balanced nutritious diet. So there's a lot of things that are out there that are helpful. The Surgeon General's office has also created a report called the Roadmap for Resilience. So that really is a good overview of everything having to do with resilience and what we can do in our communities to build that.
Well, Emani, thank you so much. I want everybody to go to the website, of course, and get driven and screen for ACEs, and let their people know in their Rotary or whatever that this program is out there. So Ventura County, we're going to get moving, and we'll be right back. Welcome back, Ventura. Emani gave a great overview of ACEs and really explained how we wanted to screen, and then what do we do with the screening. And with this next is Lucy. Lucy, can you tell us kind of who, what, where, when, why, how much? So tell us how you got in the position you're in, and because I want people to understand how education helps, and as we move upward, and then the kind of roles that you've played, because you've played an incredible role in helping us to
Thanks,
get
and thanks
ACEs
for
going.
letting me be here. So when I first started out, I got my associate's degree in literary studies. I wanted to be an English teacher, but I ended up writing technical manuals for about 12 years. And around, I think, the 10th year, I realized that writing manuals that nobody reads was a little bit frustrating for me. So I wanted to try to do something that was really meaningful in a way that was personal. So I went back to school. I got my graduate degree in clinical psychology and community psychology, and became a therapist. And that led me into a role in quality improvement. And so I work for our county health system. We serve a large population, especially of Medi-Cal recipients. And I work on things that try to improve quality for our patients, for our physicians, for our clinical staff. And I'm also a licensed therapist, so getting to work on ACEs, adverse childhood experiences, is really meaningful for me because I'm a therapist and I also get to work on the quality improvement side.
Well, with the quality improvement intervention, is that a process? Isn't it just we know exactly what we're doing right from the start? Or?
I wish. Wouldn't that be amazing? What I've learned is that I might have, decent ideas, but really the way to do it is to test changes. So you work with people who do the work, for instance, working with pediatricians like yourself and clinical teams, people who do the data entry, all the folks who actually do the work to try out ideas and see if they work and figure out ways to decide, is this something we want to maintain, we want to change a little bit, and then kind of continuously learning what works and what doesn't work and learning from our mistakes and trying again.
Usually the least paid person has the most power. It's that person at the front desk who kind of forgets to hand out the questionnaire or whatever.
Very important. Front office is extremely important in the work that we do.
Because I know that our Mandalay Bay Women and Children's Medical really worked hard on where do you put the forms and so forth. So, if we can't get that going, then the intervention piece, which is really your piece. Tell me about toxic stress. What's toxic stress, for heaven's sakes?
Yeah, so toxic stress is a stress response, because not all stress is bad. Being on this show together is stressful, thinking about people watching this is stressful, but it's not a permanent type of stress. I'm able to kind of calm myself down and, talk with you about this without, having a really negative response. Toxic stress is an exposure to something that's really kind of more than we can handle in our minds and our bodies. So it creates a response that then creates other problems like inflammation or difficulty concentrating, other types of outcomes, because it's difficult for our bodies to come back down from either those extreme types of stress like abuse or neglect, or repeated exposure to stresses.
Just if you almost hit a deer, it's usually fight, flight, or fright there. Are they going to jump on top of your hood or freeze in place or run?
Exactly.
And so our bodies are designed for that. They're designed to run away from
lions
velociraptors
and
or whatever.
Exactly. Exactly. And so, in modern society, we have very few velociraptors that threaten our health. Not too many lions, at least where we live. Maybe mountain lions, but not too often, right? So our bodies are, like you said, wired for danger and to really keep ourselves safe. But when we're exposed to something repeatedly, sometimes it can become toxic. So there's one thing that I think is really important for people to know, and that's if your child or you have been exposed to toxic stress, it doesn't mean that it's the parent's fault or your fault. It happens. These are things that, sometimes are completely unavoidable, or we do the best that we can and we still end up being exposed to toxic stress. But it doesn't mean that we're, relegated to a negative outcome. It can affect our health, but also we can do things to create more health for ourselves and for our children. And that's really building resilience. We are very resilient creatures. We pop back up. We're able to learn new things through a process called neuroplasticity, where our brains actually learn how to rewire based on what we do over and over again. So when we practice things like building supportive relationships, listening to our children when they have problems, building good sleep habits, eating foods that are healthy for us and not just fast food. Those are the things that help us, wire ourselves for resilience. Also, there are things that you can do in the moment as well. So they're called grounding techniques, and we have this on the ACEs Aware Ventura website, and you can check out some of the examples there, and there's many, many of them. But basically it means kind of bringing ourselves back to the present. When we are in that fight, flight, or freeze, we are in our, kind of most base animal brain that says, keep safe, do something that's going to keep you from getting eaten by the lion. And what we want to do is bring back the frontal cortex and have it kind of calm us down, tell us we're in the moment, remember how to problem solve, remember how to communicate. And so that could be looking for certain colors in the room. So let's say I ask myself, what do I see that's yellow? I see the stripe, I see the wheel, I see the whites of your eyes, just kidding. And we can do that in different ways as well. I can put ice in my hands and feel it. I can do a grounding technique called breathing. So, you know what breathing is called, but breathing where you breathe in, you breathe out. If you breathe in into 4 and then you breathe out with 6, then it kind of resets your vasovagal nerve, that response that keeps us heightened and keeps us nervous. So would you mind doing it with me?
No.
Okay, you can tell me what you feel. So we'll breathe in for 4. 1, 2, 3, 4, and then out for 6. 1, 2, 3, 4, 5, 6. What do you notice?
Trump's not president.
That's true.
It's very calming.
So what does it do in terms of your thought process, right? What are you thinking about? Are you worried about the future when you're breathing?
No, I'm concentrating on the breath, the air moving in and out. I feel my heart rate slowing and my brain concentrating on something other than.
Exactly. So then that's a way for us to kind of in the moment be able to regulate our own stress response. Things happen sometimes that are very stressful in the moment and we feel overwhelmed. We notice our hands are shaking, our mouths are dry, we're not able to think and concentrate, and those are some of the things that stress causes. But when we do something like breathing or looking for everything that's green in the room, that really brings this part of the brain back online and resets our nervous system to calm down.
What are some of the social things in terms of resiliency, reaching out to grandparents or just outside the family sometimes?
Yeah, absolutely. I think one of the things that I noticed in my life and that research holds out is that when we have the presence of someone supportive in our lives, it helps us be resilient. So that might be a school teacher, a grandparent, my dad, my brother, it could be my best friend at school, or just someone who I like, that I see every day, the janitor who says hi to me and asks me how I'm doing. When we have supportive relationships, that builds resilience as well.
What are some of the other materials that are available through the website and the YouTube videos and so forth? What are those? What kinds of subjects do those cover?
Yeah, so if you look at our grounding activities, document that we have on the website, it gives you some of those exercises for immediate grounding and also links to the UCLA Mindful app, which has a number of different types of meditations, and also the Breathing Butterfly, which is a 2 to 3 minute meditation video. It's available in English, Spanish, and a number of different languages. So it really doesn't take a lot of time. You don't have to go to an hour of therapy to feel better in the moment. It's something that you can do as a practice every day or when you notice that your stress response is starting to go up.
So a short, brief intervention.
Yes, exactly.
And so for the doctors, what are some other subjects that they should be going over? Exercise, nutrition, sleep, what kinds of things?
Absolutely. So, when our care teams, our providers, our nurses, our medical assistants, when we encounter our patients who have experienced toxic stress in their life and it's becoming something that's interfering with how their health is functioning now, to provide education and links to some of the materials online is very helpful. Also, Sharon will talk about some of our resources in the community for help with different things. There's a good resource called 211. If you dial 211, they'll help you get connected to all manner of different types of health and social services resources, for instance, with housing or access to fresh food, things like that.
Yeah, Emani was talking earlier about the Family Justice Center. We had a little video on the website from Rachel, and just she'd met a mother with a child who'd been sent over, and said, "Oh, where's the Family Justice Center?" And she brought her in, and 6.5 hours later, she had a place to live other than her own dangerous home environment, had food, had access to welfare support so that she could make that transition in life.
Yeah.
In terms of our physicians through the Ventura County Healthcare Agency itself, are there any tools that are coming out? So I mean, we have pieces of paper. We've got, what else is coming?
Well, technology has been such an amazing tool for us. So like you said, the way we've asked questions is typically to give a piece of paper to our patients and have them fill it out and return it. That creates some burden in terms of data entry, and sometimes papers get lost or, the provider doesn't see it. So what we are doing right now is implementing a system where our patients can use an iPad to answer questions, and it's low literacy friendly. friendly. It's got graphics that kind of help explain the types of questions that we're asking. And we do this for a number of different things. For instance, risky substance use, risky alcohol use, depression, things like that are all a part of your overall health. And we plan to add our ACEs screeners into the iPad interface. So then those results go immediately to your doctor, and the doctor is able to say, hey, I noticed that you scored high in this area. Is it okay if we talk about your responses and some of the things we can do to improve your health?
Well, the thing I look forward to with this is just information gathering. If there's an area where we're seeing a lot of high ACEs scores, there might be just a section of Oxnard or Fillmore or Ojai that needs extra interventions. That we have a set of laminated instruction on sex trafficking that'll be going in every emergency room.
Absolutely.
So that people will know that if they are there with a bruise or whatever and they're being sex trafficked, that they have a resource and have a way out. So by being able to collect this, we're also able to look at the impact on.
Absolutely.
Is there an impact on asthma? We're going to a lot of fuss. Are we seeing fewer visits? Are we seeing decrease in preterm pregnancies or better control of hypertension? And so forth.
Yeah, absolutely.
Is there anything else that you'd like to, as you think about it, as we come to a close, anything else you'd like to add in?
Yeah, I think that it's important that even though we can be exposed to toxic stress as children or young adults, those elements don't have to relegate us to bad health. Resilience is absolutely possible, and taking advantage of these resources, talking openly with your doctor about things that are going on that isn't necessarily a broken toe or an ouchy knee, but also the things that are happening in your life that might be affecting you emotionally or causing stress for you or your family.
Well, Lucy, thank you so much.
Thanks.
Ventura, so you've heard about screening for ACEs, that there are resources, that we want good exercise and nutrition and the ability to regulate our own bodies. So Ventura, I think it's time for you to learn more about ACEs, tell your neighbors, let people know. You can let 60 people know they'll be heading to the doctor. So Ventura, it's time for you to think about ACEs and get moving.